Hello, have you ever gone to the washroom, watched your urine, and wondered, why is my urine this color? Well, your urine can sometimes give you useful clues about what is happening in your body. But before we start, remember, urine color alone cannot diagnose a disease. Several things, including what you eat, the amount of fluid you drink, and medications, can change your urine color. But please, let's break it down. In today's episode, we're going to talk about the color of your urine and what it says about your body. So please, if you've not followed me, try as much as possible and hit on the subscription or the follow button and follow me. Share to a colleague or a friend. Maybe they may need it. Thank you. The number one sign or the number one color is pale yellow or amber color. If your urine is pale yellow or what we call the amber color, it is generally considered as normal. If your urine is pale yellow or straw colored, that is generally a good sign. The yellow color mainly comes from a pigment called urine, which is produced as your body breaks down substances from your blood. When you are adequately hydrated, your urine is usually lighter and it becomes more diluted. That is why you are having the pale yellow or the amber color, which is considered generally as normal. The second color to talk about is dark yellow. If your urine is dark yellow, in most situations it means it is more concentrated and you may need a lot of fluid. One common reason why you may have a dark yellow urine is dehydration, meaning your body doesn't have enough fluid. You may also notice other symptoms such as thirst, dry mouth, tiredness, dizziness, or passing urine less frequently. So if your urine is consistently dark, pay attention to your fluid intake and how you are feeling. About is when you have a very clear or clearer urine. Most people think the clearer their urine is, the healthier they are. No, that is not necessarily true. What it simply means is that very clear urine can simply mean that you are taking in a lot of fluid. You don't need to force yourself to drink excessive amount of water just to keep your urine completely clear. Most or safe health practices can keep your urine healthier. Number 4 is orange urine. Orange urine can occur for several reasons. It can occur with dehydration, but certain medications and other substances can also change your urine color to orange. So if you notice persistent orange urine and you don't know why it is happening, especially if you have other symptoms, it means that you need to talk or you need to see a healthcare provider or your medical doctor to explain what is happening. Number 5 is pink or red urine. Don't ever ignore this sign. Don't just take it normal. This one is more important. Pink or reddish brown urine can sometimes result from food such as beetroot. However, it can also indicate blood in the urine. Blood in urine can have several causes, including urinary tract problems, kidney stones, infections, or other conditions. So if your urine is repeatedly red or pink, you cannot explain it by something you've eaten or medication or the medication you've taken. Don't simply ignore it. Get it checked. See your medical doctor to explain what is happening to you. Most especially if you are having symptoms like flank pain, difficulty in urination, or you understand what I'm going. Just try as much as possible and see your medical doctor. Thank you. The 6th one is brown or a tea-colored urine. Brown or a tea-colored urine can occur when you are significantly dehydrated. However, it can also be associated with medications, foods, liver and kidney problems. So in case you are having a brown or a tea-colored urine, make sure you see your medical doctor or you see a healthcare provider to explain what exactly is happening to you. It may not be what you think. If you notice persistent brown urine, particularly if you also develop yellowing of the eyes or skin, abnormal pain, or feel unwell, seek medical attention. It may not be what you think. Now, the following point that I'm about to mention are alarming signs that you don't have to ignore. Number 1, if you see persistent blood, red or pink urine, make sure you seek for medical attention. Number 2, if you see or if you notice persistent brown urine. Number 3, pain or burning when urinating. 4, blood clot in your urine. Number 5, fever with urinary symptoms. All these signs are linking to one problem or one medical condition or the other. So make sure you see your medical doctor or your healthcare provider to explain to you what is happening. Your body is trying to communicate something to you, and you don't have to be ignored. Thank you very much. Final and important message for you today is, the next time you use the washroom, don't just flush immediately. Take note of the color of your urine, but don't panic. Urine can sometimes give us important clues about our medications that we take, about the food that we've taken, about certain medical conditions that we have no idea of. But like I said in the beginning of the video, it is not a diagnostic test itself, but it can give you a clue about what is happening in your system. Thank you very much for following this video. There is Scholar Media House bringing to you simple medical tips or simple medical information that you can use. Try as much as possible, follow me, share this video to whoever that you think may need this video, and then see you in my next video.